Well, you know, back in 1993, I was working for the Western North Carolina AIDS Project as a street outreach worker, and I was tripping over needles downtown in Asheville. So I asked my boss, who at the time was Marty Prairie Chicken, what should we do? And he said, we need to start a needle exchange program. I said, yeah, let's do it. What's that? At that time, we started to research what needle exchange was, and we traveled and visited around the country, and we brought that back here to North Carolina. And so this has been a point of access for non-judgmental, non-stigmatizing access to needles, to the supplies that would keep them safer, and to reduce their risk for HIV and viral hepatitis.
I try to make sure that they see the NEPA log, where they mark the number of syringes that they are getting, and then also if they've brought back any. Then from there, we try to make sure that they understand that there's typically two sizes. There's the shorts and the longs. And then we typically have cottons and tourniquets, cookers with a demonstration, an image to show them how to do that with a paper clip so that they don't burn their fingers. There's bags below, and then a bowl of condoms, of course, and various resources that they can pull from, whatever they're interested in, whether that be access to our local sexual violence organization, Our Voice, or our treatment and recovery guide, which is a very comprehensive guide to some different resources in the community. We also have Study Collective information that is our community's distributor of naloxone or Narcan.
So if I can just get a box of 100 needles for $10, talking about 10 cents a needle, and make sure that people have access to those 10-cent needles, that they don't share those needles, that they don't get infected, we might prevent, 3 infections, which would be a savings of close to $1 million.
Then back behind our office door, we have empty containers to take with, and then they can put their used syringes in, which they can bring them back to us for proper disposal, or if they have access to a transfer station to take them themselves, that's fine as well. We do encourage proper disposal.
We should never have to share a needle for any reason. Not for a flu shot, not for drugs, not for insulin, not for steroids, not for hormone therapy, not for vitamins. Funding's really important. Well, the demand has gotten so great, we've run out of money. That's the whole purpose of this GoFundMe page, is that we really don't have the funding to continue. There was a House Bill 972 that tells you all about it in Section 4 of that bill, which is now law and ratified. In it, it says that we must, as a needle exchange program, provide all the needles that people need, free of charge. However, there's not one nickel of public funding available at the state level or even at the federal level to help fund what's so core to this effort, to this strategy, that is to have needles available. We hope that you see the benefit not only to you, to the general community, to everybody, to our citizenry, to the public, to public health. And I really, really thank you.